Հանրաճանաչ վիրաբույժ բժիշկ Ջան Վարդանյանը մասնագիտացել է դեմքի գեղագիտական վիրաբուժության մարզում։ Նրա շքեղ գրասենյակը արդիական սարքերով ծառայում է իր հաճախորդներին, նրանց դեմքերին տալով բնական արդյունքներ։ Վարկավորված բժիշկ Վարդանյանը ուսուցանում է UCLA-ում եւ USC-ում։ Նրա մասնագիտությունը ընդգրկում է քթի եւ կոպերի վիրաբուժություն, դեմքի վերաթարմացում, ճառագայթային գործողություններ եւ վարսատնկում։ Զանգահարեք մեզ վիրաբուժական կամ այլ սպասարկությունների ցանկի համար։
Բարի երեկո սիրելի հայրենագիցներ եւ բարի եկած եք Ամերիկահայ բժշկական միության ծրագրին։ Ես բժիշկ Վիկեն Սեպիլյանն եմ, ձեր հաղորդավարը։ Այսօր ունենք մեր ստուդիոյի մեջ երկու հյուրեր, որ եկած են մեզի Implant գազագերբության կողմից, Dr. Salpy Akaragian եւ Jacklin Minasian։ Dr. Akaragiyանը հիմնադիրն է Implant-ի եւ նախագահը, եւ Jackie Minasian-ը փոխնախագահ եւ իրենց այս տարվա 20-րդ տարվա գալայի նախագահը։ Այս ծրագիրը մենք պիտի շարունակենք այսօր անգլերենով եւ պիտի փոխանցենք զանազան նորություններ Implant-ի մասին։ Welcome to the program, ladies and gentlemen. I'm Dr. Viken Sepilyan, the host, and we have in our studio tonight Dr. Salpy Akaragian and Jackie Minasian. Dr. Akaragian is the founder and president of the Armenian International Medical Fund, AIM Fund. Jackie Minasian is the vice president of the organization and the chairwoman of this year's 20th anniversary gala for the AIM Fund. Dr. Akaragian and Jackie Pariegas, welcome to our program tonight.
Thank you for having us.
Thank you. So exciting, 20 years of doing very important work in Armenia. Salpy, if you can tell us a little bit, about the history. When was the organization founded? What was the core principles of the organization, and what gave the idea to launch this organization?
Great. Thank you so very much, first of all, Dr. Sepilyan, for inviting us today. The foundation is it's 20 years now that's been in existence. I'm happy to report that. I never thought 20 years later we'll be sitting here and talking about our success stories. The idea came about in 1999 when I was doing lots of work in Armenia on different projects, and the Ministry of Health of Armenia and Deputy Minister of Health at that time asked me to consult on a case. Of course, not knowing anything about ear, nose, throat, I brought it to UCLA, and Dr. Akira Ishiyama was reached. And Dr. Ishiyama, when he looked at the paperwork, which was the audiogram, immediately he said, this child needs a cochlear implant. Hearing aid will not do it because this child doesn't hear whatsoever. And the only reason, the only way we can give the gift of hearing to this child is through a surgical procedure called cochlear implant. And of course, I was wondering, what is this? And it's a very difficult project to start because it needs a lot of professionals. You have to set up the infrastructure to make this to continue for many years. So 2003, finally, the foundation was formed. And then 2004, the first 3 children were operated in Armenia. And the team went from UCLA, Dr. Ishiyama obviously being the main surgeon, and we operated on 3 kids in March of 2004 at Yerebuni Medical Center.
Of course. And initially, the aim of the foundation was to really do procedures to restore hearing. From day one, it was the focus was to help children mostly, but also some adults, if I understand correctly, restore their hearing that had been lost for a variety of reasons.
Yes. Yes, definitely. The foundation's mission, actually, it's bringing innovative healthcare projects to Armenia, to the people of Armenia. Not necessarily only focusing on hearing. However, we started with that project, and that project is the most consuming, most challenging, and expensive project that we continue until today implementing in Armenia. We have other side projects that the AIM Foundation manages. One example is UCLA Armenia project, what we're about to publish the results very soon with Dr. Wayne Grody's group and Armenia. But as you said, our focus has been giving gift of hearing through the cochlear implant surgeries because it was a pioneering type of a work. No one had done that before in Armenia. And today, 20 years later, the project is going very, very strong. We have an incredible team, if it be here in the US or in Armenia. We have actually over 200 children and young adults, as you said, who are not they're not children, they're adults who lost their hearing as they were getting older. And we have over 200 children who we service in Armenia, which means that these children and young adults who received an implant a year before or 5 years ago, 20 years ago, they come to the foundation in Armenia and receive the accessories for the outside part of the cochlear implant system. So even though Dr. Ishiyama has done over 180 surgeries himself in Armenia, but the foundation serves over 200 because the other number of children had gone out to Moscow or to Europe and received their implants and now have come back to Armenia and need the maintenance and they need the accessories to support their hearing.
Of course, yeah. And you said that 200 children, and the first child, which you helped. I know there are some, videos and slides that we're going to show. Perhaps we should, show the video that tells us a little bit about the foundation now and have our viewers.
Every day in Armenia, there are children who live in a life of silence. They cannot hear the world around them. Children have lost all hope of hearing their childhood joys, laughter, and cannot embrace their full potential. The Armenian International Medical Fund was created to give hope to families by bringing the miracle of hearing to children in Armenia. Since 2003, the AIM Fund has been committed to creating and maintaining the Cochlear Implant Healthcare Program for candidates in Armenia.
The mission of the foundation is to bring innovative healthcare projects to the Armenian people in Armenia.
The nuclear system's external component, the behind-the-ear processor, captures sound, converts it into digital signals, and transfers the digital signals to the internal implant. The signals are then converted into electrical energy and sent to an electrode array in the cochlea. Unlike a hearing aid that simply amplifies sound, cochlear implants send a sound directly to the hearing nerve and onto the brain.
The implant itself is very expensive. However, thanks to the Armenian community in Los Angeles and some great philanthropists who believe in our cause have financially assisted, and today every single child that's been implanted is now able to hear.
It is such a beautiful phenomenon to witness these children hear for the very first time. When you see the profound joy that washes over their faces, you will never take your own hearing for granted ever again.
Thanks to the special work by our doctors and the Cochlear Implant team, children can now hear. And for the first time, break the silence with laughter.
Dr. Akaragian, I'd like to ask you a little bit about, in addition to the patients that are served, of course, there's a whole team of healthcare professionals that have benefited from the work of the foundation insofar as a field that did not exist in Armenia before the work of this foundation now does exist with the, multi-specialty approach with various specialists from surgeons to audiologists to therapists and so on. If you can talk a little bit about that part of the work of the foundation, where the foundation's been responsible to help train and prepare a new generation of healthcare professionals in Armenia.
Great, thank you. It's a great question. And the most difficult part of the foundation's work. We have trained everyone, and as you mentioned, there's a surgeon, there are anesthesiologists, nurses, audiologists, programmers, name it. And we successfully trained everyone, and they're very competent, meaning they meet the standards of the American, especially, if I may say, UCLA standard, because our surgeon is from UCLA. And Armenians in Armenia, those multidisciplinary professionals doing a superb job. We have no problem. The challenge we're still facing is training the surgeons. We started training the surgeons in 2003, and we continued, if it be here or in Armenia. However, about 3-4 years ago, Dr. Ishiyama wanted to change the approach and have the young physicians learn the skills. So finally this year, we started in 2022, we brought a young surgeon from Armenia, from Yerebuni Medical Center, to learn from Dr. Ishiyama the surgical techniques for cochlear implant. Of course, he is a surgeon, but not with ear surgeries or not with the cochlear implants. So he did receive some training at UCLA, observed quite a bit. He went back, and we're getting ready to bring a well-known otologist from Armenia named Dr. Sarkisian to continue learning the otology surgery component with Dr. Ishiyama at UCLA, and then develop her further to the cochlear implants. That's our plan. It's a little bit of a setback for us, but that's okay. We had to stop, reevaluate, and take another step. And we're hoping that Dr. Sarkisian will be at the level that Dr. Ishiyama expects that person to be in 5 years. And meantime, she will start training the younger surgeons in that ENT residency program. So that is still ongoing and something that it's dear to our heart, especially to Dr. Akira Ishiyama's, to make sure that the surgeons in Armenia, on their own, not with an assistant, on their own, can perform the surgery, cochlear implant surgeries.
Of course, that's always important for any such activities, to make sure that there is the development of talent that will allow the project to remain self-sustained, so that once the level of skill and knowledge is raised to a level, like you said, to that of any Western standards, or in a major top academic medical institution such as UCLA, that is a big accomplishment where we can be proud of that. Our homelands are elevated to that high standards. Jackie, I'm going to ask you, this year is the 20-year anniversary of the organization, and you are in charge of the gala to celebrate for the organization. If you can tell us a little bit about what the organization will be doing to celebrate.
Sure. So although it's our 20th anniversary, we're preparing for the 25th medical mission, and our goal is to raise enough funds so we can surgically implant every child that's on the list this year. And we want them to join the hearing world because the world for them is very isolated, and our goal is to operate on every single child. Now, we have a huge gala that we're planning on April 2nd. It's going to be at Grand Venue. We have entertainment planned for the night. We have a nice little program. We have silent auction. We also have opportunity for individuals to sponsor their business, or on an individual level, if someone would like to donate, support the foundation, they can do so by visiting the website, or they can through social media. We have a marketing that's going on right now where you can just click and donate any amount that you want. But the different levels are $1,000, which will get you 2 tickets to the gala and a logo that will be featuring the logo throughout the evening. There's a $1,500 level, which gets you the 4 tickets and logo and so on. So this is a beautiful cause. I'm committed to this project. I've been doing this for 15 years. I have an incredible committee who is working day and night trying to get sponsors, getting silent auction items, so that way we can operate on all the children this year. Last year, we set a new record where we operated on 25 children and young adults. That's the most we've ever done. And our numbers are over 180, children and young adults. And we hope to do another 20 this year, I think.
If not 26.
Yeah, if not 26. If we can set a new record, that would be wonderful.
Of course. And let me ask, what is the cost, let's say, or the approximate cost? I'm sure that there are variations, but what is the approximate cost per patient?
Implant itself is very expensive, but because of our nonprofit status, the lowest we've ever got the implant for was $16,000. That's the lowest.
And that's just for the device?
Just the device.
And is that the only cost that is associated with taking care of one patient?
From the foundation side, yes. It's like Jackie said, the minimum cost of an implant with a processor is $16,000, and that's for the foundation's philanthropic work that we do. We have a good price. In addition to that, there is about $4,000, $5,000 worth of hospital expenses. That includes the personnel in the operating room, anesthesiologists, nurses, so forth and so on, and plus the one-night stay in the hospital, some of the medications, some of the pre-op workup that has to be done for these children. So, but we are very fortunate. I'm very thankful that Ministry of Health, especially the Minister of Health, Mrs. Anahid Avanesian, for last year's children, all, majority, not all, because Ministry of Health doesn't support children after a certain age, their hospital bill was paid directly to Yerebuni Medical Center. We don't normally get involved, but if there is a child who comes from a very poor family and they can't even afford the hospital bill, then we step in and cover that cost as well. The implant, as Jackie said, we start from $16,000 and it can go up to $22,000. So one question is, well, what's the difference between $16,000 to $22,000? The difference is that the $21,000, $22,000 implant with a processor has other gadgets, like you'll be able to use your iPhone with the implant. Well, the 3-year-old, 4-year-old doesn't need that.
Of course.
So the quality at all, it's not in any way changed between the price range there. It is based on what is the best for this child. And the foundation also has a certain, obviously, commitment, And if the family is very wealthy, which we've had families who are very wealthy,
who can afford it,
they paid for the whole cochlear implant system. In fact, they were the ones who said, we want to pay fully so your funds can reach another child who needs it. However, having said that, the foundation still close to $6,000 per child. In-kind contribution goes every single time there is a surgery. What does that mean? That means Dr. Ishiyama's time, my time, Dr. Ishiyama's travel expenses, some of the supplies that UCLA, well, let me backtrack. Some of the supplies that it's not available in Armenia, we managed to get those. So what are those? It's the bits of a drill that they have to use during surgery are not available in Armenia. And we use about $3,000 worth of bits per child. So that is the cost also the foundation eats up or funds per child, that it's not in hard dollars, if you want to call it that way. It's in-kind contribution that we receive donations to get those bids and then get it to Armenia.
Yeah.
So it is so if you look at it, 16,000 for an implant CI system, another 4,000 say for the hospitalization, another 6,000 in kind. We're looking about $25,000 to $26,000 worth of expense per child.
Per child,
But
yes.
as Jackie said, we have never left any child behind because of finance.
And that's one thing that I do want to ask. One is to support each patient with their needs, A to Z. But let's talk about the success rates. What are the success rates per procedure? What have been historically?
100%.
Well,
We've had a
let me
great
answer
success
that
rate.
because it's statistically, obviously, we've been collecting data from day one. Every single child that Dr. Ishiyama has implanted, that Dr. Akira Ishiyama has implanted, let me reemphasize that the child has heard. Okay. There are a couple of cases that the children were not able to get language, to have a language acquisition because they turned out to be autistic. And we didn't know that because the child is about 8 months old, 10 months old. We don't have that information.
Of course.
That's in the beginning. Now, because of that couple of, I don't want to call mistakes, but whatever, less than what we expected. Now we have a psychologist, child developmentalist, that we collaborate with Arabgir Hospital. As you know, that's a major pediatric hospital in Armenia as well. We collaborate with them. And we work very closely with their team to prepare the children for surgery. They go through all kinds of screening processes to make sure we've given every single possible chance for the child to hear and speak. That's our, obviously, ultimate goal. So we've had 1 or 2 cases that the child could not speak because of those reasons.
Of course.
Yeah.
But in general, the outcomes are, for the appropriate candidate, almost 100%, let's say. And
Yes,
which is
absolutely.
really, truly outstanding, and I commend the team for that. Now, we have some slides which, I want to refer to with a little bit of history on the organization, and if we can, if Salpy or Jackie, you can walk us through what are the photos we're looking at here.
Extremely valuable, highly emotional, I must say. This is the first time when the child here, if we can go back to the first slide, first time child hears sounds. So they were implanted about, say, a month ago, then the switch on takes place, and this is a time where the child hears. So you see the reaction of the children from their faces. One is in an awe, looking up to see where did this sound come from, and the other one quietly trying to figure out, what is this I just heard? So it's a fascinating, one of a kind, lifetime experience that I wish any one of you who are watching and you're in Armenia would like to eyewitness this. Please get in touch with me, with Yerebuni Medical Center, and we will make sure to make arrangements for you to be there. The second slide has to do with our first child who was operated in 2003, 20 years ago. His name is Kevork. Kevork is the one, the little one, obviously you can tell, and the one on the right he's now 20-some years old, and he's in medical school in Moscow. And the third slide is basically, again, something so dear to our heart during the wartime, right after the wartime, 44 days war. Dr. Ishiyama operated on a soldier named Robert, who's standing with a white T-shirt there. He had his facial nerve totally damaged. And Dr. Ishiyama, working with 3 top-notch surgeons at Yerebuni and one from the eye center, he repaired that facial nerve, and this 20-year-old soldier is able to chew, smile like all of us and whatever. So it was a first of a kind and the only surgery so far we've done in Armenia. So we're hoping to expand our services and bring this type of surgery also to Armenia for people who need it. And of course, the last slide is Dr. Akira Ishiyama. As a non-Armenian, we are extremely grateful to have such an expert, extremely kind human being to give gift of hearing through the surgical procedure for our kids in Armenia.
Of course, and we are very thankful for all the work that you have been doing and the foundation has been doing. It truly is. I want to congratulate you and commend you for 20 years of this mission. Amongst other major contributions to the healthcare system in Armenia, Dr. Akaragian Implant is one of them. I would also encourage anybody who is watching, who is interested in supporting, to visit the website. Is it aimfund.org? Or come and participate in the 20-year anniversary celebration, which will be taking place on April 2nd. Again, you can visit aimfund.org to to get more information, reserve your tickets, or also make direct donations. Սիրելի հայրենագիտներ, ժամանակը եկած է, որ մենք մեր ծրագիրը պետք է փակենք, մենք 2 շաբաթից կտեսնվենք, մինչև տեսնվենք, առողջ մնացեք, բարի գիշեր ձեզ։